In this module, we're going to go over some recommendations for physical activity for people across different life stages. But before we get there, I just want to briefly go over some benefits of physical activity, which might be very obvious to you at this point in your degree. But these benefits and some of the definitions that are important to know first as well, these could be potentially important as we're trying to communicate the benefits of physical activity, to change people's values around physical activity, to motivate people, for people to find their own motivation to be physically active. Sometimes they need the knowledge and the background of how good physical activity is for them to help them perhaps consider changing their behaviors. But it's really, as we're going to learn in this class, hard to know what's actually going to lead someone to change their behaviors. So I just want to give a bit of an intro into physical activity and its benefits in this unit. But before we get there, I just want to define the term physical activity. So physical activity is an umbrella term which refers to any voluntary movement. So like my left arm is not being physically active because my right arm is picking it up. But if my left arm voluntarily moves, that's a type of voluntary movement. And any type of voluntary movement that promotes an expenditure of energy is considered physical activity. So like walking around. When we talk about physical activity, usually we're talking about things that get our energy expenditure up to different degrees. And then we can split physical activity into a number of different categories beyond that as well. So when we say exercise is a type of physical activity that's planned and it's structured, and its goal is to promote physical fitness. So going to the gym, going for a run, hiking up that mountain, all with the purpose of building fitness, that's considered exercise. You planned it out, it's structured in some way, exercise. And just as a side note, we don't have to use the terms exercise or physical activity to promote them. And sometimes those words, and we might want to work with our population to find out which words kind of work for them. Sometimes the word exercise might feel really like, I don't want to do that to some people. So for those individuals, we might use the term physical activity, or we might use the term movement or joyful movement as well. So sport is like exercise, except for the fact that there's some sort of competitive element to it, competing against someone else, or in some cases against yourself. It's usually against someone else though. Occupational activity, this is like a labor-intensive job, something physical activity you do for work. So my job is more or less sedentary, although I do stand when I teach. But I used to waitress, and that was a very occupationally, physically active job. Leisure activity, these are things you do in your spare time, like dancing or maybe going for walks with friends. And then active living, this is like a principle for living your life, like choosing to take the stairs, choosing to walk places, choosing to move around when you could just sit. So for instance, I am someone that's quite active in my lifestyle. I haven't always been. And even when I'm not getting my exercise, my at least 150 minutes of moderate to physical activity a week at a higher intensity because of fitness, I'm still moving around quite a bit, and that helps to up my total physical activity, right? So pick and choose kind of the words you want to use for your population, but I just want to give you these definitions so we get started. So when we say someone is physically inactive, we basically mean they don't meet the physical activity recommendations. So we'll go over those in the next few modules, but basically you're below that recommendation. And for adults, it's 150 minutes of moderate to vigorous physical activity a week. Is what the recommendation is, and people that don't meet that are said to be physically inactive. But obviously there's a wide range between like 0 minutes and 150 minutes in there as well. We'll talk about some of those. We'll talk about that physical activity threshold as well. And then sedentary behavior is different than physical inactivity. So I'm a good example, or how I used to be is a good example of this. Like I used to make sure I got my 150 plus minutes of physical activity a week and was exercising regularly or whatever else, but all my other time was spent sedentary. right? So I would go exercise and then I would come back and I would sit. Your waking hours, when you're awake and you're basically not moving much, and there is a more quantitative measure of this. So when you're expending, your energy expenditure is less than 1.5 metabolic equivalents while in a sitting, reclining, or lying posture. And like sleeping is about 1 metabolic equivalent, right? So it's just like you're just getting a little bit more energy expenditure than sleeping, so you're not doing much. And again, when we're defining these terms, these can help us with the evaluation with our programs and to kind of see where people are at, maybe to begin our programs as well, okay? So now the health benefits of physical activity, like where do I even start? There's so much we can possibly talk about, and the evidence is... We often argue about evidence in a lot of areas, but when it comes to physical activity and its benefits, the evidence is pretty clear and well established and robust. So from this 2006 Canadian Medical Association Journal article, pretty strong statement, we confirm that there is irrefutable evidence of the effectiveness of regular physical activity in the primary, so it stops you from getting it, and secondary, as in like once you have a disease, you're less likely to die from it or for it to get worse. So physical activity is very important in the primary and secondary prevention of a bunch of chronic diseases. And that's just a few that are listed there. Okay. And then if we meet the current physical activity guidelines, we are able to reduce those risks. And so just to get a little bit more quantitative here as well, what I love this, this is from the same article, but I really actually like this bar graph because it talks about people, it speaks a little bit more to secondary prevention. Whereas we have a bunch of individuals with either diseases or certain lifestyle associated behaviors, lifestyle associated risk factors like total cholesterol and BMI. And we notice that in all of these categories, right? So for a bunch of different diseases and some lifestyle behaviors and some lifestyle associated outcomes, for every one of this group, individuals that exercise the most, are the most physically active, and this is measured in metabolic equivalents, they have the lowest relative risk of death. Whereas the highest relative risk of death in each of these categories is in the group that gets the least amount of physical activity. So no matter where you're starting from, if your concern is risk for disease, yeah, physical activity, thumbs up, get it. It can only make things better, okay? And these are just like physical benefits of physical activity, but like the benefits of physical activity extend far beyond its physical benefits. Physical activity can help manage and reduce the risk of both depression and anxiety. It can improve sex life. It can improve social connections. It can improve family bonding. There's links to increased productivity, decreased healthcare costs, so more at the population level. Like there's so many darn good things about physical activity. Like where do you even stop? We can go on and on. And I like this slide too because it speaks to the fact that a lot of people are concerned with maybe living longer. And life expectancy in Canada is about 83 years, a little bit higher for women than men. But I don't just want to live to 83. My father's about to turn 80, and I wouldn't say he's in the healthy life years category. He's more in the impaired life years category. So I don't just want to live a long time. I also want to make sure that the majority of those years that I live are healthy. Why? Because health helps promote quality of life, enjoyment of life, and all those other things we talked about as well. So it's not just about living longer, it's about living better, right? And something, if you're an undergraduate student, might seem like 70 is that far in the future. That's not even something to concern yourself about. But building these habits from a young age and also building that fitness, building all of those those important factors that reduce our risk of disease, this is something that becomes more and more important as we age. And the sooner we can build these habits, the better. So physical activity, tons of benefits. I just want to introduce this because these are some of the things that you might choose to use when you're, like I said, marketing your health promotion campaign, or in your coaching practice, when you're talking about the benefits of physical activity. If that is something that might help that person find the internal motivation to become more physically active. In the next few modules, I'm going to start into more specific physical activity recommendations for different age groups.